Here with a report on breast cancer is our reporter Laura Windsor.
Getting up-to-date information about breast cancer prevention, early detection, and new treatments helps in the fight against this disease. Dr. Laura Lee, the medical director at the Comprehensive Cancer Center at Desert Regional Medical Center in Palm Springs, explains the importance of early detection.
The projection from the American Cancer Society for 2007 is that there will be 180,000 newly diagnosed breast cancers in 2007. This is a fairly significant drop. In 2006, the projection was that there would be 210,000 newly diagnosed cancers, 41,000 deaths from breast cancer. And if you look at the statistics over the last 35 years, the mortality or the deaths from cancer have been dropping from 1975 till 2003. The first term that we should talk about would be non-invasive or in situ cancers. In situ means in the same place. This refers to cancers that have not yet developed the ability to leave either the ducts or the lobules of the breast. It implies that it's not able to invade into the surrounding tissue or to go elsewhere in the body. The next term that we should talk about is invasive cancer, and what this means is that the cancers have developed the ability to move either into the surrounding tissues in the breast or to move to other parts of the body, either through the bloodstream or the lymphatic system. The duct, which refers to sort of the tubing system of the breast, it's sort of the plumbing, and it is a tubing system that allows the milk to make it from where it's made out through the nipple in a woman that's feeding a child. The other term that's important are the lobules. These are the functional parts of the breast. They're shaped like grapes. There are millions of them in the breast, and this is also an area where cancer can arise in the breast. The risk over the lifetime for a woman in the United States at this point in time for all women is a 1 in 8 chance in your lifetime that you will develop breast cancer. So for most women, the recommendations are to start at age 40, having mammography, having annual breast exams. For women who are from a family where it has been identified that they have an increased risk because they have a family member who's developed breast cancer and has a genetic mutation, the recommendations are to start either with clinical breast examinations 10 years prior to when that family member was diagnosed. Treatment for breast cancer has changed and is constantly evolving. Certainly there's been a huge change in the last 35 years, that 35 years ago most women that presented with breast cancer were recommended or were told to have a mastectomy. Breast conservation is becoming more and more prevalent, that we are able to, because we pick up the breast cancers earlier, we are able to treat them by taking the tumor out with a rim of normal tissue around it, giving radiation to the remainder of the breast. And so by doing that, many, many women are able to keep their native breast for the most part. We completed installation of a new digital mammography system. It is, again, state-of-the-art. I want to stress to women where digital mammography is not available to them, again, it's much more important that you go regularly for your mammography, go regularly to your primary care physician to be examined.
Early detection of breast cancer helps with treatment options and long-term survival. Knowing what to look for and getting regular screenings improves your chances. I'm Laura Windsor for the American Health Journal.